My name is Dr. Tim Davis of Orthopedic Pain Specialists. We specialize in conservative management of spine and joint injuries. Many of the traditional treatment plans are very invasive and disruptive to healthy natural tissue in order to get to the bad tissue or the injury. We specialize in innovative means of treating injuries through a needle and less invasive techniques.
After I finished the Celebrity Apprentice about 3 years ago, I was in New York. I came home, I was doing cardio, I was using a treadmill. I started to feel the nagging pain in my left foot. Every time I took a step, it was like pain. I thought maybe it was like I strained it or something. Then slowly over the course of time, I started to feel on the other foot. And people mentioned to me, they said you have to stage what you call plantar fasciitis. And it started to limit my activities. Then every research possible to try to alleviate this pain. I've seen every doctor, your name, I could give you a list this long. And I'm at the point right now, sometimes I want to cut my foot up.
Plantar fasciitis is inflammatory tissue or damaged tissue where the plantar fascia meets the heel bone. It's very disabling and people can't even walk. And like with Lou, I mean, he's a specimen of health, but this has been completely disabling for him for the past 2 years.
Dr. Davis made me feel comfortable because I've seen other doctors before, but he cared. And he reassured me that, he said, we're going to lick this problem. We're going to nail it.
Lou had seen at least 6 other specialists, but got no pain relief. I knew that I could help him with a mix of minimally invasive techniques. This is going to be so much different than a traditional open procedure because of the abbreviated recovery period. In a traditional surgery, he would be out of commission for a much longer time, and he just wasn't willing to do that. There's the tip. We can see that the tip is right down near that black layer just above the calcaneus. He's been dealing with this problem for about 2 years, so the more chronic it gets, the more thickened, the more difficult the tissue is to deal with. And so we had to do a lot more cleaning of that scar tissue than you might see on a normal individual because he is so big. Oh boy. So tell me how you're doing.
I'm doing good, you know.
He was jumping off the table when I would put even a little bit of pressure down here. And there was so much scar that we could see under ultrasound guidance. And so now let's just go ahead and... Any problem with that? No? All right, now try to push down. Any problem with that?
No.
So this is just a tremendous improvement here.
All right, Dr. David, I'm happy he came in my life. He's one doctor that answered all your questions. I have all the questions, the answer to every one of them. That's why I trust him. He's given me hope. I made the right decision. I'm glad to have him in my life because he's the best.